Hello everyone, my name is Olamipo Adekoya, a student of Brandman University. Today I'll be discussing my patient, Susan. Susan is a 32-year-old African-American female originally from Nigeria. She's currently married and has 2 children. This is her second marriage as she is divorced from her first husband, Jack. Susan got married to Jack straight out of college at age 22, and they were married for 3 years. Susan and Jack did not have any children together, and Jack was physically and verbally abusive towards Susan. When she couldn't take it anymore, she left Jack and filed for a divorce. 3 years later, she met Brian, fell in love with him, and they got married. Susan and Brian have been married for 4 years, and they have 2 young children, a boy and a girl. Susan is the only child of her parents, and she didn't grow up with any cousins around her. She often got bullied in school and couldn't really share this with her parents as they were seldom at home. Susan grew up in Nigeria, was from a poor family, and so her parents worked all the time. She witnessed her father be verbally and physically abusive towards her mom, but could not tell anyone about this. She was also molested as a child by a friend of the family that came to visit often from age 8 to 10 years. Susan works as a general manager at a thriving retail store, but still feels unaccomplished. She suffers from low self-esteem and has been diagnosed with depression and is currently on medication for depression. Susan denies any suicidal ideation or homicidal ideation or substance abuse. She's an alcoholic and states, "It helps me forget about my problems." She believes that she's not good enough and that she is unlovable. Her marriage with Brian is not the best also. He is not present in the lives of their children, and he is emotionally distant from her. She caught him cheating on her with one of her best friends before, and although he says he will not do it again, she suspects that their affair is still ongoing. When asked if she has ever considered divorce, she states, I already have been divorced once. I cannot be divorced twice. People will think that I'm the one with the problem. She states that she doesn't want her children to grow up without a father. The 3 therapies that I will be using on Susan are cognitive behavioral therapy, motivational interviewing, and interpersonal therapy. I chose these 3 modalities because all address specific things about the parent's current issues. First, cognitive behavioral therapy. This type of therapy is a short-term model of therapy that focuses on the here and now. It is goal-directed and person-centered. It helps patients identify distorted thinking and helps them address their automatic thoughts. What's an automatic thought? It's a thought that spontaneously goes through one's mind at a time. It happens without even thinking about it, and people may or may not be aware of their automatic thoughts. CBT, cognitive behavioral therapy, is based on the premise that how you think is related to how you feel and how you behave. A person's core belief, as well as his underlying assumption, affect the way that he thinks and sees himself. What is a core belief? A core belief is an unconditional belief that serves as a basis for screening, categorizing, and interpreting experiences. For example, in Susan's case, she believes that she is not good enough and that she is unlovable. An underlying assumption is an unconditional belief that shapes one's response to experiences and situations. These may operate outside of the individual's awareness and may not be clearly verbalized, or the individual may not be aware of these assumptions. They are thoughts that arise from the core belief or automatic thoughts that would lead to a behavior. For example, if someone gets close to me, they will discover the real me and reject me. Or, no one wants me around. Core beliefs screen, categorize, and interpret experiences, while key assumptions shape responses. CBT is a great choice of therapy for this patient as she has some core beliefs that she holds and key assumptions that are negatively affecting her and shaping how she acts and feels. CBT is approved therapy to be used in patients with depression, and my patient, Susan, is depressed. The next is interpersonal therapy. This type of therapy focuses on interpersonal roles and relationships. Its basis is that interpersonal distress is connected to psychological symptoms. It is used to treat depression and other mood disorders. The goal of IPT, interpersonal therapy, is to help you communicate better with others and address problems that contribute to your depression. The outcomes are influenced by the interpersonal relationships between the patient and other significant others in his or her life. ITP is very here and now and focuses on the current reality of one's depression. It thrives when the treatment alliance between the patient and the therapist is one that engages the patient with empathy and helps the patient feel understood. ITP proposes that depression results from one of the following four life changes that causes a disturbing shift in one's personal environment. The first is complicated bereavement, which involves the death of a loved one or unresolved grief. The second is role dispute, which is struggle with a significant other. The third is role transition, which is the beginning or the ending of a relationship or marriage, or the diagnosis of a disease, or a geographical or career move. And the fourth is interpersonal deficit, which is the absence of a major life event. The patient's job in therapy is to resolve the disturbing life events, build social skills, and get help to organize his or her life. Interpersonal therapy is adequate for this patient as she is depressed and has a lot of issues currently going on in her interpersonal relationships. The third is motivational interviewing. Motivational interviewing is a patient-centered counseling style that boosts patients' motivation for change, behavior change, by investigating and rectifying ambivalence. According to the Merriam-Webster Dictionary, ambivalence is simultaneous and contradictory attitudes or feelings towards an object, person, or action. It is wanting the change and not also wanting the change, or wanting incompatible things at the same time. There are four principles that form the foundation of motivational interviewing practice. They are expressing empathy, which means expressing empathy through reflective listening; developing discrepancy, which is developing discrepancy between the client's goals or values and their current behavior; rolling with resistance, which means avoiding arguments or direct confrontation with the patient; and supporting self-efficacy, which is supporting optimism. These set the tone for the way that the MI sessions will be approached and handled. The four core communication skills used in motivational interviewing are open-ended questions, affirmations, reflective listening, and summarizing. These help the patient feel safe, heard, and understood, and makes the patient more receptive to what is being discussed. Motivational interviewing is a great choice for this patient as she also struggles with alcohol abuse, and this can help her consider the need for a behavior change. There are many issues that could be addressed at therapy, and there are many different therapy styles to address a particular issue. Many times, one patient has a lot of issues or layers that need to be discussed and analyzed with their therapist. So a combination of therapy styles is usually used. All three of these treatment modalities that I will be using in the video today can be used for a single patient, like Susan, as they are all targeting different issues that she's currently facing. These three modalities will not work against each other. Instead, they would work to create a synergistic relationship that will ultimately be very beneficial to the patient. I would use all three and not just one or two, as each therapy modality has the part that it will be playing, and this would lead to a better therapeutic outcome. For the interview sessions, I would start with cognitive behavioral therapy, and then do motivational interviewing, and finish up with interpersonal therapy. I chose to start with CBT because I want the patient to first understand how her thoughts, her core beliefs, and assumptions are affecting the way she feels and the way she behaves. And then I will use motivational interviewing to address her alcohol use and help her see the importance of quitting alcohol in order to have a clear head to actively participate in therapy and improve her mental health. This will be good to introduce after a few meetings with the patient so that there is a rapport that has been formed. Finally, I would use interpersonal therapy last, as this could be a bit more sensitive to the patient, as we will be talking about the relationships in her life. By this point, I would have seen her a couple more times, and so she would be more relaxed, would trust me, and would not get defensive. My expectation from the overall encounter is for the patient to be open, honest, do her homework, and then apply what is being learned in therapy. For a lot of Nigerians and other African cultures, mental health issues are not discussed openly. It's sort of a taboo topic. So many hide from the realities of their diagnosis and do not have adequate support from the loved ones in this area. For my patient, Susan, coming to therapy consistently is a big achievement of hers, as she was quite hesitant at first and felt shame at the fact that she needed therapy. But I assured her that whatever we discussed will be private and no one will get to know about it. This helped her relax and trust me, and then I also make sure to reaffirm how proud I am of her for continually coming. CBT, MI, and interpersonal therapy will help Susan explore some of her automatic negative thoughts, make decisions to change certain habits, and confront the people in her life that she has been too scared to open up to. It is my hope that at the end of these sessions, Susan will be well equipped with some cognitive, social, and relational tools that she needs to deal with the mental health issues that she is currently facing. There will be 3 segments for each of the therapy styles. I will bring the patient in, consent her, and start with my brief therapy sessions. There will be 3 segments. The first will be a CBT session, the second will be an MI session, and the third will be an interpersonal therapy session. We will begin. Hello, Susan. Do you understand and give consent for these sessions to be video and audio taped and submitted to Brandman University?
Yes, I do.
All right. I'm really glad that you came back and have stuck with our therapy sessions, despite the fact that you shared with me that Nigerians do not really talk about their feelings and emotions, let alone talk about it with a stranger. I'm really proud of you.
Thank you so much for your kind words.
You're welcome. So, how have you been since our last session?
Not so good. I'm such a horrible mother. I never do anything right. My son had a bit of a little irritability for a few days, almost a week. He's been cranky and all touching his face and his ears. I just assumed it was because he was teething. When he didn't stop after 2 weeks, I took him to see his pediatrician. Turns out he had a double ear infection. How could I have missed that? I would never succeed at parenting. I'm such a failure.
As a mother, it must have been tough for you to feel like you could have done something to improve the health of your child, and you didn't. Has there been any time when you caught something in regards to your son's health before it was too late?
Well, yes, there was a time that my son had a rash on his thigh that I noticed one day while I was giving him a shower. I noticed that it emerged out of nowhere, so I made an appointment with his pediatrician. Turns out it was something that needed to be treated right away, and so he received a steroid cream for it.
Okay, that's good. So you see, there are times when you've been a good mother and caught things with the health of your son. You're not a horrible mother. Positive thinking leads to positive actions, and that leads to positive habits, and that leads to positive results. So you have to change the way that you think, and positive self-talk is one way to begin. You see, positive self-talk helps you focus your thoughts on words of encouragement, praise, and support. For example, I'm going to stay calm. This won't last forever. I'm in control of my feelings. I can do this. The more you say things like that to yourself, the more it affects the way that you think, act, and feel. Is that something you think you can do?
Yes, I can do this. I never thought about how much negative thinking affects a person.
Yes, it does. So, I'm going to give you some homework on this. I want you to think about some things that you say to yourself on a regular basis that are negative statements. For example, I can never do anything right. And then I want you to turn that into a positive statement such as, I can do some things right, or I can do anything I put my mind to. I want you to write as many of these statements as you can remember and then bring them with you to our next session. How does that sound?
It sounds really good. Thank you so much, and I'll see you all at our next session.
Okay. So this concludes the first session. Now we'll be moving on to segment 2, motivational interviewing. Hello, Susan. Good to see you. How are you?
I'm doing good. You?
I'm doing well. Thanks for asking. So the last time you were here, we worked on your thoughts and feelings. Do you have your journal entries for me to take a look at? Oh, thank you. These look good. Okay, so I want you to continue writing your thoughts, okay? So, what would you like to talk about today?
I don't know. My drinking is beginning to affect my job. I went very late to work due to a hangover, and I couldn't explain why to my boss. She gave me one strike and now is watching me more closely. I'm thinking that it's high time I consider this thing more seriously. But drinking helps me. There is so much going on in my life right now that it's helping me cope. When I drink, I'm in a relaxed state. I'm more calm, more at peace. I don't know. I'm torn.
Okay. So, what I hear you say is that when you drink alcohol, it calms you down and you feel relaxed. But your drinking has also gotten you into trouble at work and is beginning to interfere with your life.
Yes, it's becoming a problem. The other day, I was drinking, and after a while, I went to sleep and forgot that my mom was coming back with the kids from a weekend visit. She called my phone and rang the bell multiple times, but I didn't hear it. So she took the kids back to her house and brought them back the next day.
Wow. That must have been very hard for you.
Yes, I was really scared when I woke up at about 3 a.m. and went to the kids' bedroom and they were in there. And then I picked up my phone and saw a text message from my mom saying she took them back home with her and would bring them back later that day. That was the day I started giving quitting some serious thought. The thought of doing something that could somehow affect my children scared me.
Yeah. I can see that your children mean a lot to you and that you're committed to their safety and their well being. It sounds like you would do anything to keep them safe. Is that correct?
Yes, that's correct. I guess I have found other ways to deal with my stress and my depression that's healthy and safe. It's high time I drop this really bad habit. Thank you so much for all your help.
Oh, you're welcome, Susan. This brings us to the end of the second session. Now we'll move to segment 3, interpersonal therapy. Hello, Susan. It's good to see you today. How was the family vacation you told me about at our last session?
Oh, you remember? It was fun. A bit stressful, but fun. It was nice to come together as a family with the kids.
Oh, that's nice. I'm really glad you enjoyed it.
I did, although things are now worse between my husband and I.
Oh, no. Tell me more about it. What's going on?
He started keeping late nights, he guards his phone so closely and wouldn't even let me make a call with it. We're not affectionate towards each other and are barely intimate. The whole thing is getting to me. I'm not sleeping well, not eating, I'm more tired, and it just makes me feel more sad and down.
Oh, that must be tough for you. Have you tried talking to him about how you feel?
Sometimes it's hard to talk to him. He never seems to be in the mood and is always busy on his computer. Maybe he isn't satisfied with me as his wife.
Well, we can't come to any conclusions yet or make any assumptions. It's important to talk to him and share how you feel. Your mood and the way that you feel, your depression, is greatly affected by the relationships in your life. And so it's important to express yourself and communicate how you feel with your husband. It sounds to me that you still care deeply about him and you want things to be better in your relationship, right?
Yes, I really do.
Okay. So my recommendation is for you to write out your thoughts and the things you want to say to your husband and then speak to him about it. It'll help you feel better.
Okay, thank you so much. I always enjoy coming here and talking to you. I feel very safe and I know I can totally be honest with you. Thank you.
Oh, you're welcome, Susan. Don't forget that I'm always here for you. Please make your next appointment with the receptionist up front. This concludes the 3 therapy demonstration segments. I presented very brief therapy sessions because of the time constraints of this video, but in a real session, they would be longer. In conclusion, this video showed how CBT, cognitive behavioral therapy, MI, motivational interviewing, and ITP, interpersonal therapy, were used in one patient and the harmonious effect that they had on the current mental health issues the patient was experiencing. Thanks for watching.